Okay, welcome everybody. Today I'm here with Amy Ankrum. Amy is a psychiatric nurse practitioner. She works at Health Right in Morgantown, and she's also an assistant professor of nursing at West Virginia University, where she teaches both graduate and undergraduate nursing students in mental health nursing. Welcome, Amy, and thanks for being here with us today.
Thank you. Thanks for having me.
Okay, so we're going to talk a little bit today about holiday blues and depression, and kind of let people know what each of those is, some of the differences and things to look out for. Can you start out with giving us a little bit of a definition or background on what depression actually is?
Sure. So depression is actually a mood disorder, and it's there are a lot of symptoms associated with depression, and it can vary in severity from mild to severe. But some of the symptoms that you can see with depression are things like depressed mood or sad. Sometimes people will describe it as a feeling of emptiness or just a feeling of hopelessness. And it's usually, it's a persistent feeling. It's not just, I'm feeling sad one day, so it's a persistent feeling. Also, people will experience a loss of interest in things, usually activities, things that they enjoy. And they experience this most days. Also, people can experience sleep disturbance. So sometimes they can't sleep at all, or they have trouble falling asleep or trouble staying asleep, or they might awaken early. Or sometimes they sleep too much. So it can go either way. Also, appetite changes, and it's kind of the same as with sleep. It can either be too much, where they have an excessive appetite, or they eat to maybe make themselves feel better, or it can be the opposite, where they have no appetite or decreased appetite. And so sometimes you can see weight loss or weight gain with this as well. Also, fatigue or decreased energy is common with depression. Slowed thinking and movement. Or the opposite, where people are very restless and sometimes agitated. Also, problems with concentration, decreased ability to focus or make decisions. You can see this with depression. Restlessness, worthlessness, feelings of guilt that are often inappropriate feelings of guilt. And sometimes suicidal thoughts too can be a symptom of depression. Now, not everybody that has depression will experience all of these symptoms, but depending on whether it's severe or mild or moderate, they will have a certain, like a mild case would have a few, so many of these symptoms, and moderate would have maybe some more, and then severe case may have, even more. So, and it needs to impact the person's ability to function. So if it might be their, occupation, where it's, they have trouble getting up and going to work, or they have trouble carrying on the duties of their job because they're unable to concentrate, or their social life, they isolate, they may not be as willing to interact with people. So we see that these symptoms have to be severe enough to impact their life in some way.
And I want to touch on something that you said is that these are persistent. So about how long would these symptoms persist in somebody who might be experiencing depression?
So it depends on what we're diagnosing exactly, because if we're diagnosing major depressive disorder, the symptoms have to be at least daily or almost daily or daily most of the day for at least 2 weeks. So, but you can have other forms of depression that maybe aren't as severe or maybe not as long. So there are it depends on what we're diagnosing. There's also something called seasonal affective disorder, which is depression that occurs or sadness that occurs in the winter months, or, where you have in the months where you have decreased daylight and decreased sun. And people will experience depressive symptoms then as well. And then certainly you can have depression that's caused by, substances and medications and medical problems and things like that as well.
Okay, great. Yeah, I've talked to several of my friends about the seasonal affective disorder. It seems to be hitting right now pretty good.
Yes. Yeah.
The other thing too is, when we think about the holidays, for many of us, they're happy times. Mm-hmm. This year's a little bit different when we talk about holidays, but what would you tell people about feeling sad around the holidays or depression around the holidays?
Well, I think that for some, the holidays, we think of it as a wonderful, the song, it's the most wonderful time of the year, and for some people it is. But for some people it isn't. There are many reasons why it can be difficult for some people. A lot of times people have experienced losses. And so then it makes their traditions and the things that they normally do more difficult, or they wish they had this loved one back. And then there's just a lot of stress that goes with the holidays. So there's a lot of planning and preparing, decorating, cooking, baking, sending Christmas cards, all the things that we associate with the holiday season. And if you have somebody who is really depressed already and they don't have energy and they're not motivated, this can make it very challenging to get things done. And then also, even people that don't have depression sometimes have a difficult time with the holidays just because of all the stress that's involved. So with all the planning and the preparing. So, what I normally encourage people to do is just do what you can do. Sometimes we have to take a step back. Sometimes we have to lower our expectations. I do that every year. Like I have all these things that I want to do, and sometimes I don't get them done. And, the thing that I would tell my patients is, Christmas is going to come, whether you get all those cards sent out or all those cookies baked, it's still going to come. So I just, sometimes I don't get something done and I tell myself, well, that, it doesn't matter. I want these things done, but it doesn't, my kids don't care if I have these things done, or other people don't notice if I didn't hang the wreath up on the door or whatever it might be. So sometimes it's a matter of lowering your expectations. The other thing that I think is very important is being mindful, being aware of the moment, being aware of where you are and being grateful for what you have and living in the moment that you're in and not thinking about, well, last year we did this, or last year I did that, or when this person was around, we did this, kind of think about what you do have right now and focus on those things and be grateful for those things. I think that can be very helpful. The kind of count your blessings, and that can be difficult for somebody who really, really is going through a difficult time. And we certainly don't want to minimize anybody's pain who's really, really struggling. But sometimes that can be helpful to just think about, okay, I do have some good things. It's not the same as it was last year. It might be a little more challenging or a little bit more difficult, but there are some good things that I have that I can focus on. Also, maintain healthy habits, the things that you do normally, if you eat healthy or if you exercise, try to continue those things as much as you can. We do have access to more, sugar cookies and things like that. And alcohol for some people, there can be a lot of parties and things that take place. And so those things can kind of, disrupt our balance and really impact the way we feel. And so if you're already prone to depression or increased stress during the holidays, then you have those things on top of it. It can really kind of, disrupt things. So trying your best to maintain your regular habits, as much as you can, and limit the alcohol, or, not that you can't ever have a drink, certainly, but, really watch that alcohol consumption, because it is a depressant and can bring you down. So you just want to be careful with that. And then coping strategies, taking time to relax, taking time to, whatever, if it's drinking tea and reading a book or, whatever it might be, just try to maintain those things to help you unwind a little bit, and make sure you're doing the healthy things to help you relax. Not, switching out the glass of wine at bedtime for that decaffeinated tea or whatever, trying to do those types of things. And then the other thing that I think is so important is really just focusing on the spiritual aspect of the holidays. We sometimes get so consumed with the, secular things, and they're not that they're not fun, the gift giving and the shopping and the cookies and all that type of thing. But maybe sitting down and doing some kind of Bible study or an Advent study or something like that, and really connecting and focusing on the spiritual aspect can really help put things in perspective too for some people. And for those people who are really struggling with grief or loss during the holidays, starting a new tradition is sometimes helpful. And I think that a lot of us are going to be in that place this year because of COVID, and we're not going to be able to do a lot of the visiting and the traveling that maybe some of us do. And so, what can we do? We can do virtual visits, we can do small gatherings, with close family, being mindful of social distancing and wearing masks. And that's certainly going to be a challenge for a lot of people. But what other traditions can we start? Are there other things that we can do? Just because something is different doesn't mean that it has to be bad. And that's something that I try to focus on a lot. Well, this isn't going to be like the Christmas last year or the year before, but that doesn't mean that it's going to be a bad Christmas. We just have to focus on something different and start a new tradition. So I think that keeping some of those things in mind can be very helpful. And then when you're, if you're around somebody that has depression or you notice is really having a difficult time with the holidays, just being a support, listening, being in a listening ear to them, reaching out to them. How are you doing? Giving them a call, dropping something off for them on their porch, a little porch present or something, just doing something to brighten their day can be really helpful to people who might be struggling or by themselves or just really experiencing a lot of stress. And I know that's something that my family we're going to try to do this year is, how can we focus on other people that are really in a position that, that they don't want to be in, that's very difficult for them.
Yeah, those are some great points. And I love the focus on the spiritual aspects of the season and the reaching out to others. I think those are great traditions that can be started, and what a great time to start them right now when we're going to be forced to do something different anyway. So those are great suggestions.
Absolutely. And the thing that's interesting is I find for myself, and I think other people that I know find this to be true, that sometimes when you focus on somebody else or, another situation, it helps us to forget about our own stressors sometimes. Now, certainly if you're I don't mean for somebody who is really in a deep depression, but, maybe I'm a little stressed with the holiday planning and preparing. And if I can do something for somebody or focus on something else, sometimes I forget about, the stress that I'm experiencing, and I'm putting my energy into helping somebody else. And that can be a good thing for a lot of people.
Yeah, it brings that kind of piece of meaning to their life that they might be missing. So,
yes.
Great. One thing that I did want to talk about, because we have depression and we have, general sadness, but we also have people who are on the extreme end of that and who might be suicidal. If we were concerned about someone that we fear is extremely depressed or suicidal, what advice would you give someone as far as helping that person get the help that they need?
Right. So this is a tough one. And there's not really an easy answer because it depends on a lot of things. But what I would suggest is that you talk to this person, you express concern, express empathy, let them know that you care about them. A lot of people are afraid to address it. I don't want to ask them. Sometimes it's awkward. It's just an awkward thing to ask somebody, you don't want to offend this person or you don't want to assume something. And some people think, well, if they're not thinking about it and I ask them, I might give them the idea. And all those things are not true. We find that you're better off to ask. So if you or you suspect this, and I'll talk about some warning signs in a minute to kind of give you an indication. But if you suspect that somebody could be suicidal or you notice a significant change, talk to them, be a listening ear, tell them, I'm concerned about you. I've noticed that you're acting a little differently, or I noticed that you're a little more withdrawn, or you're not acting like yourself, or you seem different, or however you want to phrase it. But just let them know. Be respectful, do it in a private area. Don't be judgmental, so sometimes it's easy to be, judgmental or, well, I can't believe this person feels this sad, look at this or look at that. We don't want any of that kind of thing. We don't know what's going on with somebody. but trying to be empathetic and non-judgmental, and just express your concern and care for them is very important. So what I would suggest, is, I don't know if something just happened there or not, but my screen just kind of blinked. But so don't ignore it, speak up, talk to them, and look for some of the warning signs, or maybe you're noticing these warning signs. And some of the things that you might see are people that are talking about not wanting to live, or making comments, I'd be better off dead, or people would be better off without me, or, just making statements like that, or statements of not living in general, or just talking about death a lot. That could be an indication that there's something wrong and you might want to follow up. People who are, researching, looking up ways to kill themselves, or buying a gun, or doing things, making plans, that's certainly a big warning sign that you would want to follow up with somebody. If they're writing about it, writing letters, saying goodbye to people, giving away their possessions, or making plans, checking insurance policies, things like that. Those are some other indicators, some reasons that you would want to be talking to people. And then things like, noticing changes in mood, significant changes or mood swings. People who are expressing hopelessness, or anger or rage. If you notice somebody's increasing drinking more, or increasing in their alcohol or drug use, that could be a symptom or warning sign. I'm trying to think of some of the other ones. Sleep. If you notice, people are not sleeping as well, they're having changes in their sleep, or changing, or they're neglecting themselves. They're not taking care of themselves the way they normally do. Isolating. Those are all some warning signs that these are people that you want to be talking to, you want to follow up and have these conversations with. And then when you do talk to them, as I said, asking them, have you thought about hurting yourself? And then if they tell you yes, or that they're having suicidal thoughts, you want to follow up with, do you have a plan, or how would you do it? Or have you thought about ways you would do it? And then you want to keep following up with more questions. So if they say, well, yeah, I've kind of thought about it. Well, what would you do? And so continue to ask questions. Try to ask as many questions as you can to find out details if you're able to do that. And then asking, do they have access to, if they're thinking about shooting themselves, do they have a gun? Are they able to use this gun? So, did you just find out that this person was just at the local sporting goods store and just purchased a gun? These are all things that we want to be asking and kind of evaluating. Now, I know that, we're not professional, these people are not professionals, but these are just some simple questions that you can ask. And certainly if you don't know what to do, call somebody, get help. If you find that somebody is in imminent danger, like they answer, yes, I'm going to hurt myself, I have a plan, I have intent. That's another question. Do you plan on doing this? Are you intentional about this? Then, call a crisis line. A lot of areas have crisis centers that they can call, or call 911. There are a lot of websites with information about suicide. There is a suicide prevention hotline, and I can give you that number. It's 1-800-273-8255. That's 1-800-273-8255. There's also a text talk where you can text, and you text talk to 741-741. And they can help you, get resources or connect you with people or advise you on what to do. So certainly if somebody is in imminent risk, you definitely want to take steps. Call somebody, call 911, call a crisis center, stay with them. Don't leave this person. And if you can remove weapons, if there are guns, if there are knives, if there are things that you feel that they could use, pills, can you remove those from this person and get them help? If you don't think that they're in imminent danger, they don't necessarily have a plan, they're not saying that they're going to do anything, they don't have an intent at that time, you still want to do something, you know, encourage them to call their doctor, encourage them to call the suicide prevention hotline, get them connected with somebody. You know, you still want to make some kind of connection, and you want to follow up that they did that. One of the things that people don't realize is that suicide is preventable. You know, there are resources, and it's just connecting people with resources. And sometimes just knowing that somebody cares might be enough for somebody not to do it, you know. So that's not always the case, but it can be, you know, it can be for some people, just knowing, hey, this person cares about me, and, you know, they're encouraging me to get help, and they may do that. So, you know, just, I can't stress that enough, just talking to people, being, you know, giving them resources, and just really listening to them.
That's great information. And I'll make sure that I include that 1-800 number and that text talk number when I post this video. And the other thing I think it's important for people to know, because I think there's myths about who commits suicide. It can happen to any age group, any gender, any walk of life, rich, poor, whatever. So not to ignore people just because they're older or just because they seem to have everything.
Absolutely. Absolutely. So anybody, none of us are immune to it. So yeah. And, you know, sometimes people think, well, if they really were going to do it, they wouldn't tell anybody. They wouldn't tell me. And that's not true. If somebody tells you, if somebody's talking about it, even if they have said it 5 times and they've never done it, you always want to take everything they say serious and follow up on that with, you know, reaching out to somebody or contacting somebody or trying to get that person help.
Yeah, very good points. Well, thank you. You've given us a lot of great information today. I'm sure that our parishioners and community members will be able to use this information through the holiday season and even beyond.
Well, you're welcome. I hope so. And it is, you know, mental health is very important, and the effects of depression can be devastating to the individual, to families. And so there is treatment and there is help. It's just getting you connected with the person or the people to do that.